Dr. Abdu Sharkawy is an infectious disease specialist with the University Health Network at Toronto Western Hospital. He has worked around the world, and he joins me now. Dr. Sharkawy, first of all, thanks for taking time to speak with me tonight. I appreciate it.
Thank you for having me.
We have the Prime Minister self-isolating today because his wife is being tested for the COVID-19 virus. The NHL season suspended, the NBA season suspended, large events and gatherings being canceled. What's your reaction to what we're seeing now?
I think I'm unsettled by it. I think, like many people, I'm really trying to digest and process the scope of what's happening. But at the same time, I'm really trying to reflect on things and try and understand what I think are going to be sustainable measures to take and hopefully constructive strategies to help cope with what has really become a fairly overwhelming situation for the public at large to try and absorb and handle.
As you're watching this reaction, does all of what you're seeing make sense? I mean, is this the natural pattern of developments and response that you would expect to see and want to see as this outbreak progresses?
Yeah, I think that's a difficult question to answer simply because this is fairly unprecedented in terms of our recent history and an experience with an emerging infection. There have been comparisons drawn, obviously, to the SARS epidemic, which occurred back in 2003. I think the main distinction between SARS and this is that there was much more geographical containment to the SARS virus. And despite our rather vivid and very disturbing memories here in Toronto and in parts of China, we're dealing with a completely different animal here, if you will. We're dealing with something that is spreading much more rapidly, that is involving, pretty much the entirety of the globe, or will so at some point in the not too distant future. I think I'd be hard pressed to criticize too vehemently some of the measures that have been taken in an effort to contain this virus. My fear is that if we emphasize that a little too much, though, without recognizing that the other measures that are more proactive in terms of preventing further progression, further complications, further spread, we're going to be in even more trouble than we think.
Well, I'll get into that in a moment with you, but today we have the province of Ontario now ordering all publicly funded schools in the province to close over the next 3 weeks. So 2 weeks beyond the March break, which was going to happen next week anyway. Is that the right move, and what signal is that sending? I mean, some people might look at that and say that these kinds of very significant measures, do they suggest that public health officials aren't convinced that other measures will stop the spread?
That's a very good question, and I'm not so sure anybody has a definitive answer for that. What I will say is that I don't think it's unreasonable to at least try and invoke some of these measures just on a trial basis to determine whether or not they will be somewhat effective. I think the March break is a unique opportunity within which we can try and enlist some of these strategies, particularly in the school environment, and see if it is a worthwhile approach to take. And hopefully, over a period of 2 to 3 weeks, if we can ramp up our testing capacity, if we can ramp up our public education strategies, and hopefully get a more positive message out of empowerment to the public at large, rather than one of simply greater fear, we'll maybe be in a better position to determine if some of these measures are going to be of benefit over the long term.
Thousands of families are weighing whether or not to travel for March break next week. What's your advice?
Yeah, I think my advice and my attitude about this situation has shifted, to be quite honest. I think if you had asked me this question a couple of weeks ago, I would have felt much more reassured that people would not be putting themselves in harm's way by seeking out travel to a Caribbean or a tropical destination. Unfortunately, we are simply seeing too much spread in various parts of the globe at this point, particularly over the last week to week and a half, that it's difficult to justify any form of non-essential travel, knowing full well that you may be bringing back the virus in an asymptomatic fashion and potentially spreading it to someone else unknowingly, who may be more vulnerable and susceptible to serious consequences.
I guess you're the medical expert, because I think so. People in the province of Ontario, in particular, are faced with sort of two things today. There's the advice that you're suggesting. We have the Premier Doug Ford today. He's urging families not to cancel travel plans, go away for March break and have a good time. And I guess do people need to watch out for sort of mixed messages, and how do they know which way to go here?
Absolutely. That's part of the major deficit or challenge in dealing with this problem, is that there is just so much messaging out there. There is so much polarity, if you will, in terms of overreaction versus underreaction. I would say respectfully, I would ask Mr. Ford to stick to politics and leave the medical decisions and the policy making with respect to the safety of the public at large when it comes to communicable diseases to public health officials, people like myself, and healthcare professionals.
I mean, looking ahead, I guess one of the issues here is, right, the concern is not just for the safety of travelers. I think you sort of touched on it, but for the possible impact on the health system here at home in Canada when they come home, and the strain that it might face if they return and they're carrying that disease.
There's no question about it. I think at this point in time, it's prudent to take every possible strategy and measure to reduce the risk of exposure and to reduce the likelihood that people will be feeling uncertain about any tickle in their throat, any sense of a symptom that seems, unusual, and then flock to the nearest urgent care clinic or the emergency room and overwhelm our capacity for caring for perhaps much sicker and much more pressing patient needs.
And then there's the fact that this is not clearly it's a global issue, which means that we take decisions in this country that are consequential to or dependent on decisions made by other countries. And I guess looking to see what your thoughts might be on the fact that the United States has banned all flights from continental Europe for the next 30 days, and there's some pressure on Canada to consider doing the same since the Americans done it. Do you have any thoughts on that?
Yeah, I think that we are not necessarily in the same situation as the United States, and that's not dismissing the fact that our geographical proximity suggests that obviously there's going to be a lot of cross-border travel. So we can't dismiss our risk altogether. However, I would say that we've had very different strategies and approaches in terms of how this is being handled. Unfortunately, in the United States, this issue has been largely politicized. There have been a number of barriers towards accessibility to testing and the completeness of testing protocols that have been put into place. And my fear for the Americans is that the horse is out of the proverbial barn, if you will, and there are likely countless numbers of individuals who are likely already infected and who are unable to seek testing in an appropriate time frame. In Canada, I feel while we shouldn't be entirely complacent about our situation, I do feel that the strategy has been a little bit more prudent in terms of leaving the policy making and the educational piece and the testing pretty much the domain of our public health system. I think they've done a very good job up to this point, staying on message, trying to keep people calm and providing them with some common sense advice in terms of how they should respond and what measures they need to take to keep themselves and their families safe.
Okay, let's finish on this minute or so we have left. How do you, everybody talks about managing the curve and trying to make sure that we keep this, the spread, if we can limit the spread to a degree, some containment, manage that, it's clearly a much shorter duration for this challenge in this country and around the world. What should we watch for next as this goes along? How will we know when we've not got it under control, but how will we know when we've got a strategy that's starting to pay off?
I think probably the best litmus test for that would be to see very little in the way of what we call local or community spread. And what I mean by that is that at the beginning of this pandemic, almost exclusively we were seeing cases that had a direct travel link to so-called hotspots, China, Iran, and more notably places like Italy, obviously. When we started to see cases of local spread that clearly had no travel link either to the person who was infected or the people that they were in direct exposure with through work and school and home, etc., it became a source of concern that suggested that the virus was circulating within our community, and that creates a great deal of concern around the possibility that it spread without any epidemiologic link to another country. If we are seeing that is being curbed and we're not seeing a spike of new cases, I think that should be somewhat reassuring. It certainly should not lessen our vigilance whatsoever, but it should give us some degree of confidence that we're on the right track.
All right. Always good to get a perspective from the professionals on this. Dr. Abdu Sharkawy, thanks so much for your time today. I hope we get to talk again soon.
Thank you very much, Peter.